Hello, it's Dr Beth Colby from Talk Mental Health. A gentleman who suffered from bipolar affective disorder said this of himself in 2008. Being an 18-carat manic depressive and having lived a life of violent emotional contradictions, I have an overacute capacity for sadness as well as elation. His name was Frank Sinatra. Bipolar affective disorder is also known as bipolar mood disorder or bipolar disorder. It used to be called manic depression. Bipolar affective disorder is a mental illness where the mood is not regulated properly and can swing from one extreme to another for weeks or months on end. These mood variations are much greater than would be normal for an individual, of keeping with their personality. Affective disorder affects 1 in 100 people. In bipolar affective disorder, people may have episodes of hypomania, depression and mixed mood states. I'm going to talk about these and also talk about bipolar 1 and bipolar 2 disorders and also mention cyclothymia. A manic episode can start suddenly and last for between 2 weeks and 4 or 5 months. When a person is manic or high, they feel euphoric, extremely happy, or uncontrollably excited. Their thoughts can race and talk really, really fast, and they have huge amounts of energy and are overactive and restless. They may have lots of ideas or schemes that they want to do, and this may change, and their plans can change from moment to moment. People can become overconfident with inflated views of themselves and their abilities. They can feel untouchable. People may say or do things that are out of character, rude, aggressive, or inappropriate. They may have increased creativity. They may spend large amounts of money on things they wouldn't normally want and that they can't afford. They may be socially disinhibited and engage in reckless sexual activity. They may misuse drugs or alcohol. When it's severe, people may become psychotic and think things that aren't true or hear or see things that aren't there. People often have to be treated for mania in hospital. Hypomania is a less severe form of mania, and people can normally carry on their day-to-day activities and work commitments. However, their colleagues and friends would know that their mood and behaviour are not normal for them. People sometimes value these times because they're increasingly productive and creative. However, if left untreated, hypomania may become more severe and may be followed by depression. In depressive episodes, which can last for several months, people feel low in mood with decreased enjoyment in activities they would normally enjoy, and they may have less energy and be fatigued really easily. Their concentration and attention will go down, and they will have poor self-esteem and self-confidence. They may have ideas of guilt and worthlessness and bleak and pessimistic views of the future. They may have ideas or acts of self-harm or suicide and have altered sleep or appetite. If you do feel depressed and suicidal, please seek medical help urgently. In severe forms of depression, people may become psychotic. In mixed mood states, people will have the symptoms of mania and depression at the same time. So people, for instance, might have extreme amounts of energy and activity, but at the same time feel very depressed and suicidal. And this is actually a very dangerous state to be in, because feeling suicidal and having the motivation and energy to do it can be fatal. Bipolar 1 and bipolar 2 disorders as subtypes of bipolar affective disorder. To be diagnosed with bipolar 1 disorder, an individual has to have experienced a manic episode. For bipolar 2, a hypomanic episode and a depressed episode. People may have had a diagnosis of depression for years before they experience a manic or hypomanic episode, in which case their diagnosis will change to bipolar affective disorder. Cyclothymia is a mood disorder where the mood does go up and down. However, it does not reach the severity of a diagnosis of hypomania or depression. However, it does affect people's lives negatively. Okay, to summarise then, we've talked about bipolar affective disorder with different mood episodes of mania, hypomania, depression and mixed mood states. We've mentioned the difference between bipolar 1 and bipolar